Hi, in this video, I'm going to be talking about dehydration when people are going through breast cancer and its treatment. Serious dehydration is really rare, but it's important to know about. So I'm going to start with that. People who are severely dehydrated have lower urine output, or your urine might be very concentrated, very dark. It's also possible that you'll notice your skin will do something we call tenting, where you pull up on your skin and it keeps the shape of a tent. This is not, if it's not common for your skin to do this, or if it is on your hands, try it on your arms or on your loved one's arms, because that indicates that there's less fluid in the body. The other thing you'll want to look for is dry mucous membranes where you just can't, you just don't feel like you're getting enough fluid in the mouth. Now we see this with chemotherapy and with sinus infections where we find ourselves breathing through our mouth or wearing a mask, for example. So don't assume that you're dehydrated just because of that, but these are the sorts of signs to look for. If you're severely dehydrated, you'll actually notice sunken eyes, where your eyes will look like they're set back. This is, again, severe dehydration. This is really a medical emergency. So you might not be you watching this video, but somebody you care about. Call the medical team. You don't necessarily have to go to the emergency department. They might be able to give you IV fluids in the office. So there are lots of options, but this is really quite severe. What I'm going to talk about now is more mild forms of dehydration and how to manage it. When our taste is altered, when we're tired, when our routine is altered, we might stop drinking or taking in as much fluid as we're used to. Now this 8 glasses of water a day actually isn't based on any evidence, but it's a good target to aim for a couple of reasons. You want to make sure that your blood pressure stays up when you're on treatment and that you're not feeling poorly. So you want to feel as good as you can, and having nice plumped up veins is one way to do that. So a target of 8 glasses is totally reasonable. It does not need to be plain water. It just needs to be, it needs to have water in it. So you can have coffee, you can have tea, you can have juice, you can have soda. Try not to have too much of these things with sugar in them, because you don't want to be raising your blood sugar constantly. You can take sparkling water, you can put citrus in the water. Those are the things that will make it easier for you to drink. The other important thing to know, and the reason why this 8 glasses a day isn't actually true, is because a lot of the food we have that we take in has water in it. So soup and your cereal with milk, fruits and veggies have a lot of liquid in them, and electrolytes and other vitamins. So having sort of a juicy diet with lots of water containing foods is another great way to make sure that you don't get on what I call the dry side. A way to know that you're not dehydrated is if your urine is clear. So when you pee, you see clear urine. Don't get obsessed about it. You don't want to have too much water. Too much free water is actually not safe, so try not to have just excessive amounts of straight plain water. But that's a good marker. So if your urine is clear or on the pale yellow side, you're in good shape. I have covered a lot. If you want to learn more about your treatment options and what might be offered to you, visit Yerbba.com. And if this video is helpful to you or in taking care of a family member, click like and subscribe, because that will help other people going through similar things find the video. And as always, drop a comment below and we'll respond as soon as possible.